Thank you very much, Mr. Speaker. I hear a lot of noise from certain individuals in the House about how supervised consumption sites are a blight on our communities. So, I personally visited the site at the Sheldon Schumer Centre near my riding. It was clean, well-run, and nondescript. So, my question is for the Associate Minister of Health. What measures have we taken to address this crisis, and what has informed those measures?
The Honourable Associate Minister.
Thank you, Mr. Speaker, and to the Calgary-Currie for the question. In addition to the supervised consumption services offered at the Sheldon Schumer Centre in Calgary, we've also opened a supervised consumption service in Lethbridge, which has been supporting patients for nearly 2 weeks and has already saved many lives. Additionally, when we learned of a tragic spike in overdoses in the community of Standoff, AHS was able to act within days to set up a mobile overdose prevention site in the community to help save lives.
The supplemental.
Thank you, Mr. Speaker. I know it is very important that we rely on the expert knowledge of those who are experts in these areas, rather than knee-jerk judgments of those in need of support. Who have we consulted for solutions regarding treatment?
Honourable Associate Minister.
Thank you. Our approach is guided by the Opioid Emergency Response Commission, which draws from the expertise of physicians, researchers, law enforcement, frontline workers, and people with lived experience. We know that ideology should never come before people's lives. And for anyone to suggest otherwise and argue that we should deny medical, life-saving care to Albertans struggling with substance use is unacceptable. The Lethbridge Chief of Police has said we can't arrest our way out of this crisis, and he's right. That's why our comprehensive approach includes harm reduction, wraparound healthcare services, education, and enforcement.
Second supplemental.
Thank you, Mr. Speaker. Elaine Heska from the University of Alberta School of Public Health says that supervised consumption sites are also critical for connecting people with treatment and health care. So, to the same minister, what would the impact of closing down these services or reducing these services have?
Honourable Associate Minister.
Mr. Speaker, without supervised consumption services, Albertans would be at an even higher risk of overdose and death. In the first 3 months since supervised consumption was open at the Sheldon Schumer Centre, there have been more than 90 overdose reversals. That's 90 lives saved because Calgarians had medical supervision and support. 90 Albertans with the opportunity to take the next steps into primary care, supportive housing, employment, and treatment, all of which they can be connected to through this service. We believe in keeping Albertans alive so they can make another decision tomorrow, and we stand with families in doing that.
Thank you, Honourable.